Ladies and gentlemen, the Community Paramedicine program is making a difference in Northumberland. This non-emergency healthcare program, delivered by specially trained paramedics, is improving access to care for our vulnerable populations and enhancing the connections between patients and services within our community. Since this program launched in February of 2020, our community paramedics have delivered specialized care to over 3,000 residents. From in-home wellness consultations, lab testing, and medication assessment to remote patient monitoring of vital signs, from COVID-19 assessments, testing and vaccine administration, to post-injury or illness evaluation. Our community paramedics have been working in concert with other healthcare partners to deliver important preventative care services. These services are improving patient and caregiver experience.
Tell me about the program itself again. Sorry to ask to do this, but I mean, just tell me a bit about this just because of the echo. Just tell me a little bit about the program itself and how successful it is.
Yeah, it's been very successful. So this specific branch of the community paramedicine is long-term care funding. We've been given $7.5 million through to March 31st, 2024. And we're really hoping we can sustain this. So this funding is directly related to seniors. It's those are on a waiting list for long-term care, have the eligibility or the potential, or if they ever deem that they will need it. So this really opens the doors to help keep seniors in their home safe, checked on, visited, and help them either as they wait for the long-term care list, or sometimes we can even prevent that. The key to it is decreasing 911 calls, decreasing visits to the emergency room. If we can bring the care to them, and it comes back to, the right time, right place, the right care. Prevention is the key, and just as Mr. Gilly spoke about, is if we can check on him and make sure he has the walker, make sure there's no trip hazards in his home, we can prevent him from breaking a hip, from needing, longer term care. Prevention is the key. If we can identify during those visits, potentially difficulty breathing, maybe they're edging on pneumonia, and stop it, get them on some antibiotics, work with their primary care physician, work with other home and community care support services, then we can prevent them from ever getting to the point of pneumonia, going to the emergency, going to ICU. So I think the big thing is prevention and early recognition.
If this wasn't happening, what would be happening?
We would have increased call volumes in 911. We would have even more, and it's hard to imagine, packed emergency rooms. We would have, some seniors, sicker seniors, I guess, acuity higher, just without that prevention and early recognition. As Mr. Gilly said, sometimes it's just having somebody that they know is going to come, that security. And if we're on remote patient monitoring, somebody's watching me and helping me, and it gives them that peace of mind. And I think there's no amount of money we can put on that. It's that safety and security in their home. They feel loved, cared for, and watched. And I think you can't put a price tag.
And tell me about, again, forgive me if 300, you mentioned 300 when you were talking?
Yeah, so as we said, community paramedicine has been here for over 2 years. Overall, we've registered over 3,000 people into our community paramedic program. And that can be the vulnerable population, homeless, homebound people living in rural. We've, through the COVID, doing the shots, immunizations, flu shots, and visiting those people and getting them on remote patient monitoring. This specific program for community paramedic long-term care, we have over 300 people actively in our program. And sometimes it's a visit, once, twice a week. Some of it is remote patient monitoring, and that's a way that we can watch them and ensure that their vital signs are staying within normal targets. We ensure that there's medication compliance, they're taking their medications, they're safe at home, and that we can early identify. So if they come out of their range in vital signs, an alarm gets flagged, we call them, ask them if they're okay, ask them to maybe retake their vital signs, and or say, we're going to come do a home visit because we've noticed something, there's an alert going off, and let's make sure everything's okay with you. So we can go there on a non-acute, not 911 screaming lights and sirens, go there, identify it, talk to their primary care physician, maybe start them on some medications, etc. And then we've never had the 911 call, we've never had the emergency room visit. It's just been us working with the patient and their primary care physician. And I think the big thing here, and you know, I said it as well earlier, it's the coordination, and I think that's the key to it. We have a great OHTN here in Northumberland, and it's all of us, the primary care physicians and other home and community care services, support services, social services. It's all of us working together in that community atmosphere. And Northumberland is, we've been great at that. Our OHTN is strong, and I think it's that collaboration and coordination between all the team members coming to the table for what's best for the patient, and that's where I think that patient-centric is so important, and we have that.
These vehicles, 2 vehicles, they are not emergency response vehicles.
No, so what we have every day for this CPLTC, we have five community paramedics specifically for this program every day, throughout 365 days a year. Then we have our other programs. So we have actually 6 of these community paramedic vehicles. You'll see them with the emblem. And these are community paramedics, you know, running around all through the county. You know, we go as far as up to Campbellford and across to Port Hope and Brighton, all through rural Northumberland, visiting seniors in the community paramedic long-term care and or in our other community paramedic services.
David, tell me about today's announcement.
Well, this is an exciting announcement for our community. It was in 2020 that we first announced community paramedicine, helping the most vulnerable in our community, allowing paramedics to practice their profession in non-emergency settings, checking in on people, making sure they're on their medication, there's other physical, etc. barriers, supporting them with that. Diagnostic care, and now it's expanding to long-term care to support seniors in our community. And what was really impactful is we heard from the people we're serving. This has saved lives. This program's working. It saved Mr. Ryken's life in Castleton. We heard from Mr. Gillies today about the impact that this has had on his life in allowing him to age in place. And that's ultimately what this is all about, supporting people aging in place, delivering better patient-centered care, thanks to this $7.5 million investment from the province of Ontario.
You can really see, like you say, you can really see firsthand, and as I say, this will give paramedics time to do other things while these ones are focused on the project.
Absolutely. I mean, you'll see the SUVs in our community. Those are people going to help folks age in place, to help them stay in their homes longer. It's what we hear. It's what we know folks want. Provincially, you know, we're undergoing healthcare transformation. You know, ending the constant clogging and rush in our emergency departments. It's not going to happen overnight, but it's through programs like this, investments like this, that are helping people. And we heard again from it today. This is helping the paramedics check in on folks and helping people stay in their homes longer. So I'm incredibly grateful for the incredible team here at the county, Northumberland Paramedics. Chief Brown, she's been an absolute champion and advocate for this program, a strong leader, and this $7.5 million investment is being put to good work.
Tell me, sir, tell me what this program means to you.
It's security, it's company, it's keeping me well. It's an intellectual challenge in a way because I bounce things off him. I have a degree in history and political science and environmental science from Trent, and I love ideas. I love research. I have to keep busy and mentally. I just can't sit and do nothing and look at the TV, which is useless.
What do they do when they come, and how often do they come? If
They
I can
come
ask that.
twice a month because I get a checkup twice a month, and I get the B12 every 30 days, and they spend time with me. I'm not rushed. I love their visits.
Where would you be without them? What would you have to do?
Lonely, and I have to go out to a clinic, which I don't drive, and it costs every time I use community care. They don't charge me anything to come.
So it's and how long have this been going on for?
Over 2 years, I think.
They but wouldn't want to live without it. Talk a little bit about that.
I certainly wouldn't. Company, security, the medical checkups important. I'm 86. I have atrial fib, and I have fallen a couple of times. I had intracranial bleeding. They just check things. and they reinforced with me to have that water glued to me when I get up in the night. When I go out, my surgeon in Oshawa said, "Take it with you, Bruce. I don't want you breaking a hip and coming back to me."
Last question, and again, if you can just touch on this a few sentences, it gives you, just by talking to you now, it gives you a great sense of security.
Oh, yes. Yes, it does. Looking forward to the fact that I'm not going to be alone.